This excerpt comes from published research called Healing of Subfailure Ligament. It was published in the Journal of Orthopedic Research 2002, 975 to 938. And it states, ligament sprains commonly occur and can be quite debilitating, frequently causing persistent joint instability, prolonged pain, and progressive degeneration. All of those things are true of a spinal sprain. That's why it's so important for doctors to understand how to work it up properly to determine the location and the severity of a spinal sprain. Not all sprains are debilitating, but the doctor has to start to be able to differentiate, and it tells us quite nicely in this excerpt how you do that. A sprain is defined as an acute injury to a ligament or joint capsule without dislocation. Sprains are classified by severity based on clinical examination or imaging. All doctors who treat sprains know that clinical examination is very difficult to utilize unto itself, all by itself, and determine the severity of a sprain early on in an injury. What you do is you use imaging. Imaging makes it very easy, which we'll explain here, and then you correlate what you find with the imaging with your examination procedures. So it says here, grade 1 sprains are mild stretches with no discontinuity of the ligament and no clinical detectable increase in joint laxity. Okay, this is really important. So if we actually were to look at the joint motion unit, we would see no laxity or no abnormal movements here. If we did a CRMA, we would actually see no abnormal study here. Okay, now it says here for, get these off, it says here for grade 2 sprains are moderate stretches with some fibers are torn. Enough fibers remain intact so that damaged ligament has not failed. These are what these look like right here. These grade 2 sprains produce detectable laxity, so now we're going to have detectable laxity. And now on our reports, we're actually going to have detectable laxity in the reports as well. And that detectable laxity looks like this under an electron microscope. So it says here grade 3 sprains are severe and consist of a complete or nearly complete ligament disruption and result in significant joint laxity. So again, we're going to have now significant joint laxity, which we pick up over here, and we know that through consensus, this significant joint laxity also correlates with what's called alteration of motion segment integrity. And that's how you determine the severity and the location of a sprain. This CRMA report now tells you the severity of the amount of translation, here's a translation report right here, the amount of back and forth movement of each vertebra, and it'll also tell you in the same report the amount of angular finding that may occur as a result of these ligament disruptions.